Shelley, the Serenity Doula, and this is a little video about why we should think that giving birth is very like having a poo, basically because it is, and I'm going to explain to you 5 reasons why. So the first reason is that birth is like going for a poo or wee because it is a physiological process. So what does this mean? Primarily, it means how that it functions is out of our conscious control. So our body just does it naturally when the time is right, and it happens whether we like it or not. But our consciousness and our nerves, maybe our anxieties or worries, can interfere with the smooth kind of running of the natural process. For example, if you are not ready to go for a poo, you don't have any kind of feeling of urge or that your body needs to go, and your body isn't telling you it's the right time, but you've read that you should go at a certain time because your doctor said that's what you should do. So you begin straining and pushing when your body isn't ready. Well, what happens? Well, you tire yourself out. You strain and make yourself sore, probably give yourself piles, and a complex about not being able to go and worrying that there is something wrong with your body, that it's not working how it should. Now, how does this relate to birth? Well, if your body isn't ready, your baby isn't ready, and you're fighting against the natural flow of your body rather than going with it. So things are likely not to be smooth sailing, and induction is not you and your baby initiating a natural process with your natural hormones. So it can lead to the baby becoming distressed. The artificial hormones do not cross the blood-brain barrier like your natural oxytocin does. So you do not produce the correct amount of endorphins to help you relax, help your body open and make space for your baby to come out, or to help you manage the sensations. So it can become overwhelming and lead to a need for intervention such as an epidural in order to help you cope. Then you're pushing and straining when your body isn't ready or open and you can't feel anything. So it can lead to needing assistance such as Ventouse or forceps. And the surges produced by syntocinon, the synthetic oxytocin, are not natural physiological contractions of the uterine muscle. So they don't build gradually, as natural labour does, to give you time to get used to it and warm the muscles up and for them to work in an organised fashion. They come very suddenly, very strongly, and they tend to be more disorganised. So rather than doing that lovely kind of contraction from the top and pulling open and then going to a push down, they tend to be more kind of which constricts the blood vessels in the layers of the uterus, which means that your uterus then is not getting the blood supply it should. So it makes the contractions more uncomfortable, makes the surgeries more painful, and it also interrupts the flow of blood to the baby. So it can affect the blood going to the baby and make them more distressed. So you're not building slowly at your own pace that your body is setting. They're not smooth and then coordinated in their nature. And this can lead to more discomfort and your baby more likely to become distressed, which then leads to a need for further intervention in order to keep you both safe. So that first one about it being a physiological process and being ready when it's ready, you wouldn't have medication to make you poo when your body wasn't ready to poo, or there wasn't a problem with your poo needing it to come out. So that's number 1 as to why birth is like having a poo. Number 2, birth, like having a poo, works best when you use gravity to your advantage. So you wouldn't think, I really need a poo, I know what I'm going to do, I'm going to lie on my back on a bed. We just wouldn't do it. It would be ridiculous. So why do we think that it's a good position for birth? Is it because we see it in films or on the television? And where has this idea perpetuated from? Have a little think about that. But the laid back position, the lithotomy position where you're laid back with your legs on stirrups and up, was a position originally made for helping with kidney stones, but it's a convenient position for medical practitioners to see what is going on, but it is not convenient for you or your baby. It's not helping the baby descend. It's also not helpful for comfort because as you're lying on your back, the baby's going to be compressing on those blood vessels which are supplying your uterus. So number 1, it's going to mean that your uterus is not getting the blood supply that it should, and we all know from that experiment that I did in my other birth breathing video where you hold your hand up high and contract your muscles for a while, so you're blocking the blood flow to your hand, and it becomes uncomfortable very quickly. So that's what's happening when you're lying on your back. The uterus is not getting the blood flow to and from it, and so the surges become more difficult to cope with, more uncomfortable, and also it's going to be blocking the blood flow to the baby, so the baby's more likely to become distressed. So please remember, it's your body, it's your baby, and it's your informed choice to be in whichever position feels most comfortable for you. Your baby is bigger and harder than any poo you will ever have. So use gravity to your full advantage and adopt a position that feels right and comfortable for you. And for ideas of different positions, you can watch my birth positions video, my seated positions video, and also my descent of the baby through the pelvis. There's all different ideas of movement and positions that can work best for that. So that's idea number 2 as to why having a baby is like having a poo. Birth number 3, birth, like going for a poo, works best when your natural hormone functions are promoted and allowed to progress without being disturbed. So what does this mean? Well, would you feel comfortable and safe going for a poo on a bed in the middle of a brightly lit room with unfamiliar smells and sights and sounds, an open door that anyone can just burst in at any time, people coming in and going that you don't know, asking questions, machines beeping that you don't even know what they're beeping for, uncomfortable monitors maybe strapped to your stomach, several strangers staring at you saying to you, well, if you relax, if you just relax, things will work better. Why don't you have a sleep? Then it will work. We'll just sit here and type up our notes in the corner whilst you have a snooze. Then at the critical moment, when you finally feel safe enough to actually go for your poo, someone says, okay, I need you to push harder, do it now. Okay, keep pushing. Yes, come on, push really hard. That's going to work it. Shouted at by someone you don't know, staring right at your private parts. Does that sound like the ideal situation for you to have a poo? No, when I say these kind of things, it sounds ridiculous, but then we've got to realise that birthing in this situation is quite ridiculous too. It's not ideal at all. Think of mammals in nature, your cat, your dog, a cute bunny rabbit, whatever cute or big hairy fluffy thing that you like. What do they do when they give birth? They follow their instincts. They go somewhere they feel safe, instinctually safe, not in their brain safe, but in their instinct safe. It's quiet and dark and familiar, where they're not going to be disturbed by people asking them questions about their bowel movements or interfering with their natural breathing cycles. Birth, like having a poo, needs privacy, familiar sights and smells and sounds. It needs dim lighting and warmth and safety. And what many people don't realise, the big secret as to why birth seems to go awry, is that we suddenly started believing that birth is dangerous, that we need experts to watch over us and command us as to what we should do, and that other people external from your body know better than you how you feel, what position you should be in, what you should be doing. When actually what we need is to trust that we are meant to birth our babies, that our bodies are made for it, that we need a quiet, private space with people nearby who make us feel safe, maybe with us, calm and supported, and help us when we need it, that the lighting is dim, that we are warm and cozy because that helps the oxytocin work, that there are familiar smells and sounds and sights, and that, there's help, but it's at a reasonable distance if we need it. Because if all of the machines that go beep and the needles and the resuscitation equipment is right there, our subconscious can't help but worry that something's going to go wrong. It's looking at things thinking, what's that for? Why do we need that? Why is that in the room? Why is that so close? So you're already worrying and getting your adrenaline peaking. And you probably know from some of my other videos that adrenaline counteracts oxytocin. Oxytocin is what we need for birth to happen. It causes the contractions to happen. It causes them to build in regularity and strength in order for the baby to come out. And if you interrupt that flow of oxytocin building in the system with adrenaline and worry, labour stops. And then you get blamed. You're failing to progress. Well, you're not failing to progress. The environment is causing you to fail to progress. The environment is causing the failure, not you. It's not your body. Your body's like, okay, I'm not safe here. I don't want to have a baby here. This isn't a safe place. I need to be somewhere dark and quiet where I feel cozy and happy and on my own and not stared at by lots of people. So it's the environment letting you down, not you or your body. So you see, the things that our logical brain thinks will make us feel safe and make things go smoothly is often actually having the opposite effect. And where you might be at home and your labour's going really well and things are progressing at a rate that you can cope with, just the stress of the journey to the hospital, or somebody then taking a blood pressure or smell of disinfectant, it can be enough to disrupt that cycle of the oxytocin building, and then things can start to go down the wrong track. And this is why huge studies have shown that home birth and birth centres are a safer place to have babies when you're low risk than a hospital setting. And that's just by being there. That's just by being in the environment, because it affects that natural flow of your body. And, much like going to the toilet, if somebody bursts in the room or makes a loud noise, it stops you in your tracks. This is what happens with labour. It's exactly the same kind of situation happening. So yes, that's why I'm relating back to the poo again. It can be easier to understand, that you now know that trying to poo in these circumstances would be a nightmare. You just know that instinctually. But we've kind of forgotten that about birth. But yes, they are the same. So number 4 for why pooing and birth is similar is that pooing should not be forced. It shouldn't be a forced pushing, because this can lead to strains and hemorrhoids and tears, and both exactly the same. So breathing and allowing your body's natural ejection reflexes and mechanisms to take place, working with your body is the best way. And you can look at my breathing video on here for different breathing ideas. But breathing your baby down, allowing your body's natural ejection reflex to happen and aiding that with the breath by taking a breath in and then breathing the baby down is far better and more likely to prevent you from tearing, from you causing hemorrhoids, from you causing pelvic strain, from you causing burst blood vessels. You don't want to be holding your breath and turning into a beetroot. It's just not, you don't do that when you have a poo, and if you do, you end up in trouble. And it's exactly the same way with babies. So that's reason number 4. And reason number 5 is that having a baby actually feels very much like having a big poo. Often people think that they're pooing themselves when the baby is coming lower, because as the head is descending into the pelvis, they're very close to the sacrum. If you watch my video about the baby's descent through the pelvis, you can see that they're really sitting on that sacrum where the rectum sits, so where you have a poo. So they are squashing all the parts of your body that are normally moved by having a bowel movement. And so, having a baby does feel like having a giant poo. The same sensations happen. And do you know what? Yes, there is sometimes a little bit of poo that gets squeezed out. But your midwife will quickly wipe it away. And, it's a really good sign that your baby's nearly there. And you may never even notice it happens. Midwives are very subtle and they're used to it all the time. So try not to feel embarrassed, because quite honestly, they get a little bit excited when they see a bit of poo because they know a baby's coming. So there you go. There's my 5 reasons as to why giving birth is like having a poo. I hope this has been helpful. If you want any more information, please do head over to my website, theserenitydoula.co.uk, where I've got my online antenatal course, and you can learn lots more about birth to help you feel informed and to make the right decisions for you and your family. I take care. I'll see you on the next video. Bye.